We are recording now, so hi and welcome, and thank you so much for registering for today's webinar. My name is Carrie Ingram. I'm the program coordinator for the Breast Health Collaborative of Texas. And if you ever have a problem with the volume, just go ahead and type something on the chat box if you can, and just let us know. We're doing our best to make sure that you can hear us. So I'm joined today by Jean Hanks, who is the Assistant Director of Operations for St. Luke's Episcopal Health Charities. And we are going to give a short presentation on two online resources that are really helpful for a variety of healthcare professionals. So thank you all for listening in today, and I'll go ahead and I'll get started. All right, so a little bit about our organization. If you're a member, you might already know all this, but we're the Breast Health Collaborative of Texas. We are a 501c3 organization based out of Houston, but we are statewide. So our mission is to unite the Texas breast health community to educate, advocate, navigate, and maximize resources. And we have over 580 members across the state, and we're always growing, and our membership is free. So thanks to all of you online who are members. Just a little bit about what Jean and I are going to talk about today. We're going to tell you a little bit about the need for the health safety net in Texas, and if you're a healthcare professional, you already know that there is very much a need for a health safety net, but we're also going to review some types of safety net clinics that are out there, and just to get you familiar with the terminology that is going to be used on the Breast Health Portal, which again is an online resource that will has a clinic locator tool and also a mapping tool that has health data, and we'll go over that shortly. And then I'll turn it over to Jean, who will talk to you about Project Safety Net and the continuum of care. So just a quick overview of the breast health need in Texas. I'm sure these are statistics a lot of you have already seen, and you see it firsthand also, is it's almost 25% of Texans lack health insurance according to the 2010 U.S. Census, and that's compared to a national average of 16.8%. So, we're the biggest and the best, but, we're also number one in the number of people who don't have health insurance, and everybody who works with patients knows how much that can delay cancer screenings and then cancer treatment, and by the time you get to it, it might be late stage. So it's just a whole host of problems. So and it's also that Texans have the sixth highest rate in the country for people who are at or below the federal poverty level. So it's also a lot of people who are, they're working hard, but they're barely making it, basically. So health insurance is another big expense that they might not be able to handle. And 33% of uninsured Texas women who should have had a screening mammogram in 2011, only 33% of them did. And about 15,000 new cases are expected in Texas in breast cancer just this year, according to the American Cancer Society. And that is only women, that statistic as well. So you can see that there's a big need to do some outreach and that kind of thing, and kind of coordinate services. So, but a lot of you know that there are problems in coordinating that care for patients, because it's hard to know what services are available to who, because everybody has different eligibility guidelines and who's accepting Medicaid, and there are lots of little tricky ins and outs. And resource guides. So I'm sure a lot of you are familiar with like the paper resource guides that you might pick up at a health fair or something like that. They can go out of date, as you know. So if you picked it up a couple of years ago, a lot of the family planning clinics on there might be closed now. So that's kind of one problem in lacking a tool to help you coordinate that care for patients. And even though charity care exists, it is out there, but it's not always easy to find. So here are some of the clinics that are available to the underserved to try to that you can navigate patients into who need this help. So federally qualified health centers, or FQHCs, they receive federal funding from HRSA, and they don't, in theory, they don't turn individuals away from their doors, regardless of whether they have insurance. They're nonprofit hospitals, which about 5% of their budget is required to go towards charity care. There are city and county clinics and hospital districts, which are all government owned, and they require residency within that specific city or county. And a couple of other types of safety net clinics are school-based clinics, so it's preventative and primary health care that's available to students on a school campus. And there are nonprofit providers, which kind of for our purposes today is an umbrella term that includes charity clinics who don't turn patients away, and other organizations that provide some form of low or no cost healthcare support services to individuals who they might have eligibility guidelines that they need to qualify for. The American Cancer Society, for example, provides prostheses and wigs and transportation and that kind of thing. So again, nonprofit providers is a pretty broad term for our purposes today. So that kind of brings us to the breast health portal. So I just showed you a lot of different types of clinics that are out there. They're scattered all over the place. Texas is a big place. They could be right on your block and you wouldn't know that. So the breast health portal, which is www.breasthealthtexas.org, unites Texas's nonprofit providers of breast health services with one search. So there's a free online clinic guide, and there's also a health data resource that's available on the portal. And it is managed by us, the Breast Health Collaborative of Texas, and St. Luke's Episcopal Health Charities, who started the portal, and we work with them on expanding it and teaching people how to use it. And the clinics and organizations manage their own details on the breast health portal. So that includes hours and services. So the idea is that they keep it up to date themselves, and they know what's going on at their clinic, and so they'll share that with the users of the breast health portal. So there are two sides to the portal. The first is the clinic locator, which you can use to find breast health service providers for medically underserved patients and clients. And there are 305 clinics and organizations currently listed on the portal in 78 Texas counties, and we are ever expanding it. There are 254 Texas counties, so we have a while to go, but we've done our best to try to create a good list that is ever growing, and it's anybody that provides something in the spectrum of breast health care. So it could be screenings, so screening mammograms, clinical breast exams, diagnostic services like imaging or diagnostic mammograms, treatment, and then even just education and support, so support groups and survivorship services. So anybody that is listed on the portal could provide one or all or any number of those kinds of breast health services. So that's who you'll find listed on that clinic locator. So you can also build your clinic list with up-to-date clinic information, and we'll show you how to do that in a moment. And the second side of the breast health portal is the mapping tool. So if you're a grant writer or a program developer or somebody who just wants to know like what their neighborhood looks like in terms of demographics and how their health is doing, there is an interactive mapping tool. So you can use it to identify areas for expansion of breast health services, and you can use it to gather customizable data for grants. All right, so we're about ready, and I'll walk you through what the breast health portal looks like and how to use it, just a step-by-step overview. So again, the website is breasthealthtexas.org, and when you go to it, it looks like this. Looks just like this. And so what we'll talk about on the first side of it is the clinic locator. And it's also, you can see on the side right there, it says find a clinic now under the breast health portal. So again, that's what it looks like. And you can switch it to English or Spanish, depending on which language you prefer. And then this is what the search looks like. So you have to enter 3 pieces of data here. So first of all is services. So what kind of breast health service are you looking for? You can leave it for all services, just so you can see anyone who provides any breast health service, or you can get more specific, and I'll show you what the drop down looks like in a moment. And then there's also a place to put in a zip code. So for yourself or for a patient or for a client, you can put in their whole address as well, but you really only need the zip code, so to find something that's close to them. And then the third thing that you need is a search radius. So you can go in very close, so that's how far out you want to go from that zip code. So we recommend that you go at least 25 miles out, just to kind of get an idea of all the services that are there in that area. But you can go out as far as 1,000 miles, and that is for, maybe some West Texas people who are looking for a really specific service that might not be available there. So these are the services when you do that service drop down. Again, you can leave it all services, which looks for any of these, or you can look for mammograms that are screening. You can also look for diagnostic mammograms, different types of biopsies. Again, it's that screening, diagnostics, treatment, education, and support services that are listed in here. So you can get as specific or as general as you need to get for the service that you're looking for. So in this example, I've selected a screening mammogram within the zip code 77034, that's here in Houston, and then a search radius of 25 miles. So again, those are the three basic pieces of information you need, and then you hit that search button. And this is what the search results look like. They have a list of clinics here, and they are sorted by, you can see at the top where it says sort by, they're sorted by distance, so how far they are from that search radius just by default. So you can see next to each one of the clinics where it says add to queue, distance 2 miles, distance 8 miles, that shows you how close those clinics are to the zip code that you put in. You can also actually click off where it says add to queue. You can start clicking off those little check boxes, and then you can throw it into just one sheet that you can print out or email to yourself or a client. So if you're somebody who likes to work off paper, even though you have the service, or if you're going out in a neighborhood and you won't have access to a computer, you can look up a specific zip code that you're working in and then click off some of these clinics and then just print it out and have it with you. But you can always go back and reprint those out, and that's kind of the idea that this information lives online, so it's updated. And so I'll go over also the basic details for clinics that you can see listed here. The top one there is the Rose Southeast, and it tells you their address, their phone number, and what type of clinic they are, and when it was last updated. So we do try to keep them updated, but you can see the Rose was updated last, I think that says this, it might have been July or August, I can't tell, last year. But then you can see that the Pasadena Health Center, 3 down, was updated just in February of this year. So you can kind of get an idea of how up to date this information is. And again, like the clinic, the terminology I went over of the different clinic types, if you kind of get to know a clinic type, for example, and you know somebody is an undocumented patient, for example, you might want to send them to a federally qualified health center because they won't check residency. So that's kind of what those clinic types are there for you. And another one for, as an example, is a hospital district. If you know somebody doesn't live in that county, then you might not want to send them there if they don't have insurance because they won't have access to those services. So this is just really basic information. But if you look next to the clinic names, it says details next to each clinic. So the Rose, there's Shifa and Pasadena Health Center, and then just to click on, you can click on all of those their names and their details, and this is what the additional information on each clinic looks like. So again, at the top, you can see the name of the clinic, the address, and there's actually a link there for a Google map, which is really nice. And if you're trying to tell someone how to get there, you can just go ahead and click on that and give them directions from this page, and then their phone number and their website. But then it goes into more detail about the clinic types, what languages they speak there, what kind of payment methods they accept. So if they accept private insurance, Medicaid, cash, or if some clinics don't accept cash at all, or if it's free services. So it goes into detail about that and some other basic information. And some of them have additional information. So here the Rose has put in a little bit of background information about established in 1986. And then below all of that, all of those little gray boxes are the services provided there with additional details on each service. So you can see that BCCS biopsy, core needle, and all the different types of biopsies. It's a big long list, and this is what it looks like when you scroll down. So you can get an idea of what services they offer there. And if you want more information on one of the services, you can click their little plus signs next to each service, and it will give you any additional information. For example, I clicked on support groups, and it has some information that support groups are offered on several days and at different times. So call for more information or check the website. And sometimes we'll have different hours. For example, if a dental clinic is listed on there, the dental clinic might only be open, Mondays and Thursdays of every third week of the month or something like that. So you can always check the service details. And another thing that we do recommend is always calling ahead and just making sure that service is definitely still offered there before you kind of refer a patient there. Of course, we think of the portal as like one really good tool, but it's not the end-all be-all of everything that you're trying to do. So you can see that they offer this service, but they might have some really complex eligibility guidelines that they didn't put on here because it was just pages of information. So you might call ahead and find out that your patient isn't really eligible for that service. So again, we just recommend that you call ahead before you start referring patients for any of these services or going for yourself. It's always a good idea to call. So I'll just let you know about the 304 clinics that are listed on the breast health portal. They're on there because this is a permission-based list. So we're not like a phone book where we just throw everybody on there. We've done research on all of these, and they're listed because they've been called by us, the collaborative, or the charities, or just to make sure that they would like to be included. And then only employees can add their own information, their own organization. So they're the ones who know their clinics and will keep it updated. So that's kind of who is in charge of keeping all of that kind of information up to date. Although we help if we hear something around, like this clinic isn't accepting cash anymore, then we'll go on and take the cash off ourselves. But we do kind of leave it up to the people at the organizations to keep their own information up to date, because it really does serve them to let community health workers and nurses know what services they offer and all that, and it just helps everybody. So if you're wondering, if you're looking at the portal right now in another window and you don't see your own organization and you think you should be listed, you can register at any time. It's free to be included, and again, this is free to use. This is a completely free service. So you would click that register new site link on breasthealthtexas.net to sign yourself up. So that is the overview of the clinical locator, and I know it says questions, but if y'all could save them to the end. Although I do see one from Ava, who says, Ava from Ethan in East Texas, she says, I'm confused because when I call to schedule a mammogram with the Rose, they tell me they have to have a referral. That's interesting, because
in order to get a mammogram, a screening mammogram, you have to have seen a provider who's done a clinical breast exam who says that it's a screening mammogram and this is not a diagnostic mammogram.
Mm-hmm.
So you have to have a provider referral, and then if there's any difficulty with the mammogram, then that information goes back to you and your provider. So a referral, that kind of referral is required.
Now, is that when I think of referral, I think of something where the doctor has to call ahead of time?
You're talking about an order.
Oh, an order. Okay, just an order ahead of time, right? So that makes sense. That you have to have that clinical breast exam before you go ahead and get it. So
does that answer your question, Ava?
Let's hope so. I still have the phone muted, but again, we'll go back over anything that you have questions on at the very end when I'll unmute the phone. So Ava says yes. So very good, Jean. Thank you. So I'm going to go through the second thing that the breast health portal does, which you can see when you go to breasthealthtexas.org. It's called Mapping Research on the left-hand side, and it lets you access neighborhood-specific health and demographic data with mapping tools. So I'll just give you an overview of that. If any of you, again, are grant writers or program developers, or you just want to know what's in your neighborhood, it's a really neat tool. So when you click on that, you do have to register it. Again, it's for free. You just register, and then you get a little email that you have to confirm that you've registered, and then you can use the mapping forever after that. But
you may have to sign in each time.
Yes, but it never expires, and again, it's free. So when you sign up and you log in, this is what the map looks like when you first get there. So if it looks like Google Maps, that's because it is. It is a drag and drop Google-based map of Texas. So you can, put your cursor down and you can move the map anywhere. And all of this information is statewide. So there are selections of data to overlay onto the map on the left-hand side of the screen. So, and I'll go over those in a moment.
Let me just give a hint right here. I at the charities, we apologize that we're so Houston-centric. We didn't envision that the breast health portal would become so statewide, and so it does land on Houston, and you have to move it. So I would move it before you add. I'd back out as far as you can, and I'd move it to the area you want before you start adding layers.
Right, and that's a great tip, because this is a nice PowerPoint, so you don't have to sit there and see the data like loading every time you select a piece of data. It has to kind of calculate. But yeah, that's a good tip to go ahead and move it to where you want to be. And when you said back out, there's a zoom bar on the right-hand side of that screen where you can get in really close, like street level, or you can be pretty far away. And we're pretty far out. This is Houston. You can see the Beltway in 610. And then you can, that little boundary drop-down box, you can also overlay like things like zip codes and school districts and just additional information for you to look at on the map. So about the data sources. So this data comes from the U.S. Census Bureau, the Texas Cancer Registry, and Texas Vital Statistics. And it's really small if you can't see it. It's different types of data include demographic data, so that's age, race, gender, cancer incidence, so that's rate of cancer diagnosis per 100,000 people, and then cancer mortality, which is another rate per 100,000 people. So how many people are dying of cancer, and then there are some other little pieces of data: uninsured, poverty, how many low-cost mammograms are available in that area, and then clinics, which includes all of the clinics that we just are included in the clinic locator tool. So just so you can see what I mean by selecting data and seeing the data, I went through and I just selected some different pieces of data for this example. So I've selected Hispanic women age 40 to 65 plus, so that's mammogram age women, and I selected the breast cancer incidence rate between 1995 and 2007 in that population. So all of these little shapes with colors in them that you see pop up on the map, those are census tracts. So that's how the U.S. Census defines a neighborhood, basically. And the color that's inside them corresponds to, there's a little legend down at the bottom of the screen. I was hoping I would have that. Yeah, so the color matches the range number of individuals. So the little red places mean that the rate is between 91 and 272, which is about normal breast cancer incidence rate. And then the closer that those colors get to purple, the higher the rate is. So I'll just back up one more time so you can see what I mean. You can see some of them are big red places, so that's kind of how many, the rate of breast cancer incidence for Hispanic women age 40 to 65 plus falls between 91 and 272 per 100,000 in those areas. So on the next slide, I clicked on the purple area that shows up here in Houston. That's the Jersey Village neighborhood, if you can't read that. But you can click on each one of these little colored pieces, and that will give you the actual count. So if you can't read that, the rate is 997 out of 100,000. So that means an average of 997 per 100,000 Hispanic women in 45 to 65 plus were diagnosed with breast cancer between 1995 and 2007. So it's kind of one of those things where if you start to play with it, you'll kind of understand it a little bit better. It's kind of confusing to see it presented like this. It is really interactive, and once you start clicking around and seeing all of the information that's available and just kind of trying to understand what the data is telling you, you'll kind of get the hang of it. But this is this is a brief overview. So you can also build reports if you need to refer to that information in grants and that kind of thing. There's a little add to report that shows up when you click on a census tract, and then there's a report button on the left-hand side that will put all of the census tracts that you're looking at into one sheet, and you can refer to it again and again. So one last little thing that I did for this demonstration is I overlaid the clinics that are listed in the Breast Health Portal Clinic Locator, so you can actually see where the clinics are. And you can see the green one, the little green, dropper shapes are federally qualified health centers. The little red ones are nonprofit providers. And then there are little circles with numbers, and that means that there's a lot of clinics in that area. So if you actually zoomed in, you could see which clinics they were. But you can actually click on each little shape, and it will tell you what clinic is there. So you can see one of the closest clinics that's to that Jersey Village area is the Spring Branch Community Health Center, which is right there. But you can see that there's no clinic actually there in Jersey Village that provides a breast health service that's listed on the breast health portal. So if you were looking to maybe do some outreach to enroll Hispanic women to get their annual mammograms, you might consider Jersey Village. If there's a high incidence rates of cancer, you can maybe serve that that community. And I'll give you an example of one way that that we use the portal to help us with the project. Is we did an intervention project with St. Luke's Episcopal Health Charities, and the portal told us where the we were trying to reduce the no-show rate for mammograms for African American women. So we looked for neighborhoods that had specific incomes of African American women who were mammogram age, and then we went there and did participatory groups. So we got the people in that community who seemed to need that service the most to tell us, what the problems were, so we could try to address those problems. So you can use it for a lot of different things. Again, you can just hop on, and if you're wondering how many people, and if your neighborhood is, one of the ones that has a high cancer incidence rate or anything like that, you can get on and check that out. So, and Wendy Ross, I see she pointed out that FQHCs do check for residency.
Hers does. It's not everyone.
Oh, okay. Oh, okay. All right. So that's not a blanket. So I shouldn't have that as a blanket statement for all FQHCs. Okay. So that was the overview of the mapping, and I'm going to turn it over to Jean Hanks, who will tell you about Project Safety Net, who is the breast health portal's twin.
Yes. Thanks. Well, Carrie knows this stuff backwards and forwards, and this is meant to be an introduction, and I fully recommend that you sometime before Friday evening, because this information will sort of evaporate out of your mind, go on site and spend 15-20 minutes clicking on some of those buttons and seeing the information that you can get. It won't take you very long to figure out how to manipulate the information, how to move the map around, and how to learn what you want. I think that the finding services piece is straight up and easy to do, but the mapping has valuable information, and I hope that people will take advantage of that. So Project Safety Net is managed by St. Luke's Episcopal Health Charities. The Project Safety Net is identical to the breast health portal. We have a little bit different number of providers, and we're in 75 Texas counties. And the services we list are different. They're meant to be primary care. Now, I am a lumper, not a splitter, and someone has made a very finely detailed list of all the services. So you can see that we've been pretty descriptive, as the breast health folks have, about exactly what kind of service. But if you want to just find primary care, you can click over there in that last column. You'll see that it says primary care. You can click on primary care in the selection, and you'll be able to access primary care services. What you see here also is that mammogram screening is listed. So mammogram screening, if you're a primary care clinic and you list mammogram screening, you don't actually have to say you're a breast health portal clinic, and it will still come up. So we want screening to be available on both sides of these portals. So it's important to us to get as many people as possible listing their services, and if they offer mammogram screening, we will always encourage our primary care sites to list that, even if they don't do additional breast health services. So we do have some differences in our data. The drop-down menus for finding a clinic are identical, except for service list. But our mapping is a little different. We have information both by census tract, which is 1 unit, and by zip code. So the census tract information is quite similar to the breast health information, except that we have live births, and we have some information about medically underserved and mortality. Unfortunately, that is a Harris County list. In the zip code data, we have, again, some Harris County data, the emergency department visits. If you're in Harris County, this is a really interesting and important data, but it's only available here because it's locally reported. But the CHIP enrollment is statewide, so that information is available statewide. And of course, both in either forms, census tract or zip code, you can overlay the clinics. So Project Safety Net has a wide variety of clinics listed. As Carrie said, FQHCs, federally qualified healthcare centers, usually have the broadest range of services. If you have patients who are struggling to get the services they need for their care, and if their families have illnesses, many people fall into a place where when illness strikes, family finances go down and they struggle to find services. And so FQHCs and charity clinics with broad range of services are good resources to have on hand. We, like the Breast Health Collaborative, we encourage the listing of new services on Project Safety Net, and the enrollment is the same and it's at no charge. It does take a village to keep the information current, so if you notice something isn't current, please let me know, or notify the provider that it's not current. I was at a discussion the other day and they were saying, and we've added Sunday hours, and they saw me in the audience and said, oh yes, we have to add that to Project Safety Net. It's not the first things people think of when they have good news and get to add things, that they need to update their Project Safety Net. So we encourage everyone to keep an eye out. So Project Safety Net plus the Breast Health Portal really provides a continuum of care that makes sure that women and their families all get access to care, and that women particularly get mammogram services and more if they need it. So with that, we're open for questions.
Oh yes, and I just wanted to point out, I put together a little resource list because, as I mentioned, the Breast Health Portal and Project Safety Net, they're not really the end-all, be-all of everything that you're trying to do. So some other provider searches that are available at these URLs. There's a Medicaid provider search because, again, it's mostly almost 100% nonprofit providers who are listed on Project Safety Net and the portal. And I'm sure y'all know that Medicaid and Medicare providers are often, private MDs, or they're not nonprofits, or they're at, at a for-profit hospital or that kind of thing. So if you're looking for someone who qualifies for Medicaid and looking to where to send them, you can use that Medicaid provider search. There's also an FQHC search that that HRSA puts out, the BCCS provider search, which is really good. Then there are also just some general resources. There's the texascancer.info. They put out like really great county-specific little resource guides. I think they update them every year, but you can access them, especially if you live in like a rural county, and it kind of tells you what's in your county for cancer screenings and treatment and what's closest to you. And then there's also the Texas Benefit Bank, which a lot of the questions that we get when we do these trainings is, well, are there services like listed on the portal, like, people who do transportation, or they'll help people with their bills? And the answer is no, not necessarily. Some of them listed might do that, like the American Cancer Society, for example, but it's not a service that you can actually select in that little drop down and select. So the Texas Benefit Bank, they will train you on, it's called the Benefit Bank, and it's a really neat little eligibility kind of, again, a bank where you can put in a patient's information and it will fill out all of these forms for you automatically, like Medicaid forms and CHIP forms and just different kinds of state and federal aid forms for you, and it will tell you whether they qualify for those. So we encourage y'all to look into that if you haven't already and you think that's something you could use. And then again, just some good numbers to have on hand for special cases, or again to help with like utilities and transportation. The American Cancer Society's cancer navigation number, and the United Way 211. And 211 also has their resource guide available at 211.org. And you can actually go in and search to see what kind of service. It's a little bit tricky to use, I found, but it is pretty good, and people will always answer the phone. Both of those are open 24 hours a day and available in a lot of different languages. So now I'll go ahead and I'll open it up for questions if anybody has some, and I'll unmute the phones if you're on the phone. But if you have a question, go ahead and type it in as well if you're not on the phone.
All callers are muted. All callers are unmuted.
All right, now it's unmuted if anyone on the phone has a question. Anybody? Were Jean and I just that thorough that you don't have any
You were.
questions? Yes, and for those of you who are outside of the kind of the greater Houston area, and if you're looking in another window and you're like, oh, well, you know, I live in Dallas and I see this major hospital system that isn't listed, or I live in Deep West Texas and I don't see this listed. You know, you can let us know. Again, as Jean mentioned, it's ever growing. It takes a village. So we do try. We have like several projects throughout the year that where we research, and Gloria Robinson, who is here, is our education and outreach manager, and she's always researching people to call and ask them if they want to be a part of the breast health portal. So it is ever growing, and if you have any complaints or see anything that's wrong, just let us know, and here's our information. And again, I'm Carrie. I'm the one on the top, and I'm the one who sends emails. And we are happy to help, and we're also happy to answer any questions you have if you're confused about what you're looking at, for example, or you need to know a specific piece of data that you can't find on the mapping. We can help you out. So if you don't have any questions, did you have any questions in the room, anybody? Yes, so all right, so we'll go ahead and we'll wrap it up. So thank you all again for tuning in, and next month on April 25th, another 4 Thursdays lunch and learn webinar is on basic overview of breast cancer treatment.